Student, good morning. Today we are discussing pharmaceutical aerosol under the subject pharmaceutics 2. Pharmaceutical aerosols. There are so many objectives behind this topic, like what are aerosol, what are the use of aerosol, what are the various type of aerosol, components of the aerosol, actuator and applicators use, what are the advantage of the aerosol, how the aerosols are prepared. These are the objectives behind the study of pharmaceutical aerosol. In first part, we see what is a aerosol and what are the components of aerosol. In that, we have drug product in concentrate, either it may be a solution, emulsion or dry powder. The second component is called propellant or compressed gas like carbon dioxide, nitrogen oxide. On the other hand, some liquefied gases are also used. Then the third point, the container. The container is usually made up with the aluminum, steel, tin, glass. The last part of the aerosol is called valve and actuator. These are metering, spray or foam. So to manufacture, there are two main methods. These are applied. Those are called cold fill process and pressure fill process. The mechanism of aerosol deposition and particle sizes. So the advantage of aerosol. Aerosol is a suspension of fine solid particles or liquid droplet in a gas. The natural aerosol like cloud, fog and smoke. In case of pharmaceutical aerosol, the pharmaceutical aerosol is a suspension of fine solid drug particle or a liquid drug droplet in a carrier gas or propellant. The pressurized dose formed as carrier gas or propellant is compressed or liquefied under the pressure to expel the content from the container as a fine solid particle or the liquid mist. Inhalation drug delivery system. Inhalation drug delivery system or inhalant as drug is inhaled through the nose or mouth to the lungs. The components of aerosol as we see in the figure, the drug product concentrate, second propellant, then container, valve and actuator. When we see the second picture, that will also show means valve, stem, valve, compressed gas or propellant vapor or liquefied propellant or a solvent along with a dip tube. On the drug product formulation as a solution, emulsion or suspension or a powder, we can have solution of aerosol, emulsion aerosol and suspension aerosol. The foams are produced when product concentrate is dispersed throughout the propellant. The propellant is an internal phase. That means the emulsion behave like a oil in water type of the emulsion. The second main component is called propellant. Propellants are chemical with a vapor pressure greater than atmospheric pressure at a temperature of 40 degrees centigrade. These propellants are simply compressed gas or liquid under the pressure can readily be vaporized into the desired pressurized gas. The propellants is one of the most important component of the aerosol package. In other words, we call it a heart of the aerosol. It also serves as a solvent for certain active ingredients. Propellants as a compressed gas or a liquefied gas. Compressed gas propellants really occupy the head space above the liquid product in the can. When the aerosol valve is opened, the gas pushes the liquid out of that can. The amount of gas in head space remains the same, but it has more space result of the pressure drop during the life of the can. The example for these carbon dioxide, nitrous oxide and the nitrogen. On the other hand, liquefied gas as the product used, some of liquid propellant turn to gas and keep the head space full of gas. Pressure in the can remains essentially constant and the spray perform maintained throughout the life of aerosol. The type of liquefied gas we use in that first one we have a hydrocarbon like liquefied petroleum gas, propane, butane and isobutane. On the other hand, halocarbon, these consist of chlorofluorocarbon, trichloro, monofluoromethane, dichloro, difluoromethane, dichloro, tetrafluoroethane. These contents are the example of for the liquefied gas. Now, these propellants having certain main points like a compressed gas, pressure falls during the use, doesn't have any environmental problem. Whereas hydrocarbon propellants, these are most common, cheap, good solvent, doesn't have any environmental problem, bad taste or flammable. Chlorofluorocarbons. These are most common, cheap, good solvent. Environmental problems are there because of the ozone layer. The FDA banned chlorofluorocarbon. Another example for that is hydrofluorocarbon that is replaced with the chlorofluorocarbon. No environmental problems are there, but this is very costly. The container for the aerosol we use with certain condition like maximum pressure or a temperature in the Fahrenheit. Suppose we use a uncoated glass, for that maximum pressure is less than 18 at the temperature of 70 degrees centigrade. Similar with the coated glass, plastic, aluminium, stainless steel and tin plated steel. These are the few examples of the container which are used for the storage of a pharmaceutical aerosol. Another main point is a valve. The valve will be produce a multifunctional, like it capable of being easily open and closed, regulate the flow of product in concentrate form. It also regulates the amount of emitted material The valves are capable of deliver the content in desired form, like in the form of mist or in the form of spray or in the form of a foam. The mist is a phenomena of small droplets suspended in the air, whereas spray is a dynamic collection of a drop dispersed in a gas. The process of forming a spray is called nebulization or a atomization. For that, the continuous spray valve or metering valve or a foam valve. There are three types of main the valve which we use like called continuous spray valve, metering valve or the foam valve. In case of the continuous spray, this is most common use valve, whereas metering valve that is accurately deliver a dose of medication applicable to dispensing of the potent medication. On the other hand, we have a foam valve. Only one orifice lead to a single expansion chamber of appropriate volume to allow the product concentrate and expand into form of a ball or a foam. Executed. This is designed button to activate the valve assembly. These allow easy opening and closing of the valve. It is an integral part almost every aerosol package. This is design and dimension as determine the physical form of emitted product concentrate either in the form of a spray or a foam. These are mainly few types like in case of spray the various opening is 1 to 3. Second, in case of foam the large orifice. In case of solid stream large opening as ointment. Special application they are designed to deliver medication to the appropriate site of the action like in throat, in nose or in case of eye or introduced into the vaginal tract. Manufacturing of pharmaceutical aerosol broadly having two methods we used. In that first we call a cold fill process, the second is called pressure fill process. In case of cold fill process, both the product concentrate and propellant must be cooled to temperature below 0 degrees centigrade, where the liquefied make a chilled product concentrate quantitatively. Equally cold aerosol container then liquefied gas is added. The heavy vapor of the cold liquid propellant generally dissipates the air present in the container. Containers and cramped into place means the container pass through a water bath about 55 degrees centigrade to check the leak or distortion in the container. This method properly some ingredients will liquefy when cooled. Aqueous solution cannot be filled by this process since the water will turn to ice in the low temperature. Second method we have a pressure fill process that is more commonly used than the cold filling method. This method carried out essentially at the room temperature and product concentrate placed in the container, valve assembly is inserted, crimped into the place, then liquefied gas under pressure added through the valve. The product may evacuated prior to filling or during the filling. Tested after filling operation is complete and the valve is tested for proper function. Having advantage, there is a less danger of the moisture, contamination of product, and less propellant is lost in this process. The mechanism of aerosol deposition as we see in the picture, that means the nose, anterior ornofex, proximal generation of the lower respiratory tract. Now you see it may be used through the nails or with the help of mouth. Advantage of aerosol. The advantage, the drug directly delivered to the target organ like lung. Less dose required, so less systemic exposure, so less toxic. Aerosol doses are generally smaller than the systemic doses. For example, the oral albuterol is 2 to 4 milligram, but in case of inhalation, the dose is 0.2 milligram. Systemic side effects are less severe with this method as compared to the systemic delivery like injection or oral route. The onset of effect with inhaled drug faster with oral dose, and since drugs are absorbed directly into bloodstream via lung, so there is no decomposition or loss during of drug in the gastrointestinal tract. Since medications are sealed in a container, there is no danger of contamination of the product with the foreign material. There are few disadvantages of aerosol also. The main loss of drug means 10 to 20% of drug goes to the lung. Remaining drug, where it goes? The remaining drug lost in the device, exhaled breath, oropharynx or in the environment. The dose variability may lead to drug loss, number and variability of device type, confuse patient and clinic. Lack of standardized technical information on the inhaler, lack of knowledge of correct or proper use of aerosol device by patients, difficulty in coordinating hand action and inhalation, correct breathing pattern is difficult, drug loss may lead to dose variability. Method of therapeutic inhalation of the aerosol as we see in the figure 1 and 2 means canister, mouthpiece and dust cap. First of all, we have to remove the cap and inhaler shake so to dispense the drug. Patient should breathe normally but not fully. The inhaler of the mouthpiece is then put in the mouth and the lid closed around it. For example, in case of the asthmatic patient, the asthmatic patient use inhaler as in case of asthmatic attack. Second method, the patient should breathe slowly, at the same time activate the aerosol, pressing down the canister. Breath should be held for 10 seconds or long as the patient can comfortable. The patient then slowly exhale out. If we use another dose to be taken, least 1 minute should elapse before reporting the exercise. Means if we need another dose, there must be a gap between the primary or secondary dose. The type of aerosol inhalation delivery system, mainly two types. First one we call inhalation with the help of inhaler. Second, nebulizer. Inhalers are portable handheld device. These are two types. First one is called metered dose inhaler. Second, dry powder inhaler. In case of metered dose inhaler, that is most commonly prescribed, this device push out the pre-measured spray of the medicine when person secures the inhaler and measured a puff of medicine is released. This method having a short treatment time, reproducible dose emitted, but along with the advantage, there is few disadvantages are there, like fixed dose concentration, failure to shake and alter drug dose, limited range of drug, hand breathing coordination is difficulty for many patients, proper inhalation pattern and breath hold can be difficult. Type 2, in that dry powder inhalers. Dry powder inhalers are bolus drug delivery device that contain a solid drug dispensed in a dry powder mix and fluidized when the patient inhales. In this method, drug is inhaled as a cloud of fine particles. This device filled into a hard gelatin capsule or a foil blister disc which loaded into device prior to the dose. There are certain advantages: propellant free, not contain any excipient, and there will be a little and no patient coordination. Formulation stability is there. This method can deliver larger drug doses than the previous one. Along with that, we have certain disadvantages. This method is less efficient at drug delivery than the first one. Twice the dose if we require for a delivery. The deposition efficiency dependent on patient inspiratory airflow. Potential of dose uniformity gives the problem. Type 3, the aerosol inhalation delivery system. The type 3 we use the nebulizers. Distinctly different from the previously explained method. In this case, the drug is dissolved or is suspended in a polar liquid or water. The used drug cannot be conveniently formulated with the previous method, so therapeutic dose is too large. Nebulizers are electric or a battery powered machine, turn liquid drug into fine mist, then it will be inhaled into the lung. The user breathes in the mist. The nebulizer is usually used in the hospital and ambulatory care settings. It is also useful for the chronic disease management because that is a less convenient. Nebulizers deliver a large volume of drug. Drug concentration can be modified, useful in very young, old, and distressed patients also. Use of pharmaceutical aerosol also used the topically we use the local anesthetics. The example for local anesthetic is a benzocaine. We use for wound washing, rubification like methyl salicylate spray on the bandages, and proprietary burn applications, antibacterial like neomycin, antifungal spray, miconazole, anti-inflammatory steroid like dexamethasone, and in case of certain pain management. In the pain management, we use a painkiller spray. The pharmaceuticals are very convenient and no need to touch the skin. Minimum contamination of the unused product. Thanks a lot